Indoor environments harbor a variety of microorganisms originated from its occupants, both human and animal, and from the outdoor environment. Very often, problems of excessive humidity, water damages, or poor ventilation contribute to the abnormal development and buildup of those microorganisms indoors. And there is evidence of a link between exposure to indoor microorganisms and the development of respiratory and allergic symptoms, particularly those arising from exposure to these microorganisms that flourish in these damp indoor settings. This is particularly true in infants and aged population. Immunocompromised individuals, for example, patients undergoing cancer treatments, are also more vulnerable. There is sufficient evidence that health symptoms like nasopharyngeal inflammation, wheeze, cough, shortness of breath, onset and exacerbation of asthma, bronchitis, respiratory infections, allergic rhinitis, and eczema can be related to being exposed to airborne microorganisms. There is also clinical evidence of hypersensitivity pneumonitis and allergic bronchopulmonary aspergillosis developed as a consequence of exposure to molds. The microbiology of built environment laboratory is dedicated to the analysis of microorganisms present in indoor spaces with potential impact on the health of the occupants. We aim to identify potential pathogens and allergens in indoor spaces, helping to reduce the risk of exposure-related problems. The lab performs the quantification of bacteria and molds suspended in indoor air, the identification of molds present in indoor air and surfaces, the detection and quantification of several allergens on dust, and the microbiological analysis of different materials on demand. Patients are referred to a consultation within the National Service of Environmental Health at SHAM by their GPs or MD specialists. Most frequently, they are referred because of respiratory and allergic symptomatology that does not respond well to prescribed therapy with unknown causes or following an emergency room admission. The field nursing team of the Service of Medical Expertise and Data Intelligence conducts air, dust, and surface samplings at patients' houses. In the more complex patient cases, I go on site myself with the team to perform a more in-depth investigation and to decide the set of analysis to perform, and to work with the patient towards solutions in terms of risk management. These analyses have a huge impact on patient clinical management. Identifying environmental triggers on patients' households allows the prompt action on reducing exposure and thus minimizing the symptoms effectively. And this is what we have been observing. A high percentage of our patients with respiratory or allergic symptomatology are exposed to molds and to allergens. Removing them from the exposure or recommending effective measures to eliminate or reduce the exposures results in an improvement of the patient's health condition, as well as saving clinical resources and expenses.